It's already tough enough being a teenager in between all of the social pressures and the stress of your homework and extracurricular activities. And then on top of that, some struggle with a skin condition that can carry an additional burden. Many people think that atopic dermatitis, also called AD or just eczema, is just a skin condition, maybe some itchy patches on the skin, but it's really more than skin deep, and it can be a serious and debilitating condition that affects many teens in the US. And here to talk about atopic dermatitis are Dr. Sugarman and Jake, who is a patient, a teenager that's actually living with severe atopic dermatitis. Good morning to both of you this morning.
Good morning.
Good morning.
So, doctor, first of all, can you describe to us atopic dermatitis and the symptoms and really the triggers, how this comes about?
Sure. Thank you for having me. Atopic dermatitis is a chronic inflammatory skin disease. And what that looks like clinically is red, dry, scaly, inflamed patches on the skin. And for folks that have more severe disease, this can be on a lot of the skin. Up to 80 or 90% of the body surface area can be affected with these inflamed patches. And one of the hallmarks of atopic dermatitis is itching, and these patients have relentless itching, and if they have inflammation over a majority of their body surface, they can be absolutely miserable.
I can't even imagine, Jake, with you being in school, having to try to concentrate and sit through class when you're itching. I mean, anyone that knows that's had a rash or even a sunburn that's itching, it's just, you can't even concentrate. Does it come on with stress, or doctor, what brings this on and how can we help it?
Well, stress probably impacts every aspect of health and disease. I'm not sure you can blame stress on atopic dermatitis or vice versa per se. I'd like to just remind everybody that I'm here on behalf of Regeneron and Sanofi to raise awareness of the disease state of moderate to severe atopic dermatitis. We have a lot of tools in the toolbox to manage this disease. It's important to know that we're not going to cure it, but we can control it.
So Jake, tell me about a typical day for you and how you're managing being a teenager with atopic dermatitis.
So a typical day for me, I get up and my skin, the first thing I notice is my skin is itching or bothering me, or I itched it the night before. And I find some rummage around my room, find one of my many lotions or creams, put it on, depending on how bad it is, I'll put some ice on it. And then I just kind of go through my day while trying to mitigate the symptoms as much as possible.
Thank you for having us. I'd just like your viewers to know also there are plenty of online information, the American Academy of Dermatology.
Of course, you can find out all this info on our website, which is fox4morningblend.com.